Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the Language of Medicine 12th edition by Davy Allen Chabner. Before I get too far into our slides for this week, I want to stop really quick and mention that it is week 1. You do have a video review on the syllabus that I encourage you to watch as soon as you can. There's good information in there that you need to know about the class. Also, there is a 10-question quiz on the syllabus to make sure that you have retained the most important parts of the syllabus review. There's also a video review of the studying for this class. Students have given me quite a bit of feedback over time, and they have found that watching the study guide does help. So I encourage you to take a look at that. The third video you may want to watch is a review of the book features, and this is a very short video review, and it talks about what's at the back of your textbook and how that can help you with studying and also as you're going through the textbook itself. So I wanted to bring those things up. Week 1 and Week 2, we will be focusing on Unit Objectives 9.1.1 through 9.1.13. And again, you can take a look at your syllabus for that information as to specifically what those objectives are. Week 1, we cover Chapters 1 and Chapter 2, Basic Word Structure and Whole Body Terms. This video is on Chapter 1. There will be a second video on Chapter 2. So let's get started. What are the chapter goals according to your textbook? Well, we want to make sure that you identify basic objectives that will guide your study. We want to teach you how to divide medical words into their component parts and make sure that you learn the meanings of those basic combining forms, prefixes, and suffixes, and then use those to build words. So, objectives in studying the medical language. Well, one thing is to analyze words by dividing them into their component parts. You'll see as we go through, especially this chapter, exactly how that works. Relate the medical terms to the structure and function of the human body. Although we do not study anatomy and physiology in this course, it really dovetails nicely with anatomy and physiology because we're looking at the structure and function of the body and the terms that go along with it. So you'll notice there's a lot of overlap or interplay in between the two. We need to be aware of spelling and pronunciation problems because with spelling and pronunciation can come medical errors. Your book will give you some good examples of this. In fact, if you want to turn to page 2 in your textbook, that's where we're at. Students have told me that they find it helpful sometimes to print out their PowerPoints and take notes on those. So if that's something that you think would be of interest, go ahead and stop the video now and go ahead and print out the PowerPoints and be able to use those to take notes. Okay, so moving on, we're on page 2. If you look at page 2, they give us a really good example of where spelling and pronunciation can cause issues. The two words that they give us are ilium and ilium. They are pronounced the same, but they're spelled differently, and they definitely have different meanings. Ilium, I-L-I-U-M, is a part of the hip bone, whereas I-L-E-U-M means a part of the small intestine. So you have those. From my experience in the medical field, and I have over 20 years of experience there, the ones that I saw the most were hypo and hyper. It's so important that you know the difference between hypo and hyper and that you pronounce them appropriately in a clinical setting, and also that you write them or are able to recognize them, because there can be a lot of misunderstandings if you're talking hypo and someone else is typing hyper. Big difference there. All right, so we're going to start off here with a quick pop quiz. All medical terms have a combining vowel, two roots, a suffix, or prefix. As you go through this chapter, and definitely the next one, you will find the answer to that question. So I'm not going to give it to you right at this point, but would encourage you to come back to that. Which element appears at the beginning of a medical term? You want to think beginning, before. And so think about, look at these words. What does any of them have sort of something that means beginning or before, just in looking at them? All right, so let's talk about how we analyze words and how we figure out their meaning, how we break them down. We're now on page 4 in your textbook. Hematology. Hemat is the root and it means blood. O is the combining vowel, and logi is the suffix. It means the process of study. And we always read back to front. So it's going to be the process of study of blood. So hematology means the process of studying blood, or the study of blood, either one. One thing I'd like to point out here is the combining vowel is O. Almost all the time, combining vowels are O. Occasionally they're an I or something else, but it's very rare. Mostly they are O. And I will try and remember to point those out to you so that as you're studying, you make sure that you notice that. So let's talk about these. The root is the foundation of the word. So if we go back to hematology, you see there's a root there. That is the foundation of the word. A suffix is the word ending. A prefix is the beginning. So if you go back to our question here, which is the beginning, you now have the answer for that if you weren't aware of that to begin with. So the prefix goes before the root, the suffix goes after the root. And in between are combining vowels. And again, they're usually O. If you are a math person, you will appreciate this last one, which is an equation. The root plus combining vowel equals the combining form. And you'll probably hear me say that every week when we study. It's to remind you of that, to help you through. So let's take a look at electrocardiogram. We have elector, which is the root. We have O, combining vowel. Cardi, which is another root. And then we have O for combining vowel. And then we have gram for suffix. So if we read it, again, back to front, it is a record of the heart's electricity, or record of the electricity of the heart, whichever way you want to put it, but you always read back to front. And notice here you have two roots. You don't have a prefix, but you have two roots. And whenever you have two roots, you usually need a combining vowel. And notice here at the end, again, between the root and the suffix, the last root and the suffix, you again need a combining vowel, unless that suffix starts with a vowel. If the suffix starts with a vowel, you will not need that combining vowel there between the root and the suffix. So let's try another one. Gastritis. Gaster is the root, itis is the suffix. Itis means inflammation. So if you read back to front, it is inflammation of the stomach. And again, here's an example where you don't need a combining vowel because the suffix itself starts with a vowel. Gastroenterology. You have two roots again with a suffix and you have combining vowels. So reading back to front is the process of studying the stomach and the intestines, or study of the stomach and intestines. So we have three general rules when it comes to word analysis. And those rules are, you want to read it from the back to the front. You want to drop the combining vowel before a suffix that starts with a vowel. And you want to keep the combining vowel when you have two roots. You got to keep that combining vowel between the two. Another one, hypogastric. On this one, hypo is the prefix. Gaster is the root and ic is the suffix. So, pertaining to, below the stomach. You see how that is? Pertaining to, below the stomach. Next one, epigastric. Again, prefix, root, suffix, pertaining to, above the stomach. Above the stomach. All right, so let's go through our combining forms that we're learning this week. You have adeno or adeno, which is gland, arthro, joint, bio, life, carcino, cancerous or cancer, cardio, heart. Oops, let me go back here. All right, another pop quiz. Which term means inflammation of the gland? Well, guess what? We had gland right here. This should give it to us, right? We come back here. Oh, we've got two different ones that have that same root for gland. Itis and oma are the two different suffixes. Remember, we just learned about the suffix that meant inflammation. Think back to inflammation of the stomach, and that should help you be able to select the correct one for this. Okay, moving on to those combining forms. Cephalo, head, cerebro, cerebrum, schizo, to cut, crino, to secrete, cysto, urinary bladder, cyto, cell, dermo or dermato, skin. So notice that you're going to want to make sure that you know that both dermo and dermato both mean skin. Electro, electricity, encephalo, brain, entero, intestines. Which term means the study of cells? Ooh, we just had this, didn't we? Ooh, we did. Combining form there, that means cell. That should help you. Now you've got to think about study of cells. Study. Remember, we looked at that suffix. So if you put those together, you should easily be able to identify this one. Erythro, red, gastro, stomach, glyco, sugar, noso, knowledge. Oh, watch out. There are some interesting spellings when it comes to medical terminology. That G is silent when you pronounce it, but you need to have it there when you spell it. Gyneco, woman or female. Hemato or hemo. Ooh, we've got two for blood, so beware of that. Hepato, liver. Iatro is usually treatment. It's very rare that it's physician, but it possibly could be. But most often, iatro is treatment. Leuco, white. Logo, study of. Nephro, kidney. Neuro, nerve. Onco, tumor. Ophthalmo, eye. Now I'm going to stop here on ophthalmo because, again, you have to watch out for that spelling. The PH-TH is an unusual combination. There are not many things that are spelled with those four letters together like that. But ophthalmo, in this combining form, you'll see quite a bit. It is. And so make sure that you study how that is exactly spelled. Osteo, bone. Patho, disease. Pedo, child. Psycho, mind. Radio, x-rays. Reno, kidney. Rhino, nose. Sarco, flesh. Secto, to cut. Thrombo, a clot or clotting. Uro, the urinary tract or urine. Now we're going to talk about a few suffixes. And notice that we start off right here with two that mean pertaining to. So ac and al both mean pertaining to, so you'll need to make sure that you memorize that. Algia means pain. Site is cell. Ectomy, excision or removal. So another pop quiz. Which suffix means to cut out or to remove? We just had it here. I'm going to go back. Maybe you can see to cut out or to remove. To cut out or remove. I think you can get it. All right, so some more suffixes. Emia is a blood condition. Genic is produced by or in. Globin is a type of protein. Gram, record. Ick and ickle are pertaining to. So now we have four suffixes that mean pertaining to. So make sure you're familiar with all of those. Ion, process. Ist, specialist. Itis, inflammation. Logi, process of study. Oma, tumor mass swelling. Opsy, process of viewing. Osis, a condition that's usually abnormal. So note that. It's when you see osis, you want to be thinking it's usually an abnormal condition. Pathy means it's a disease condition. Scope is the instrument that is used to visually examine. And scopy is the process of visually examining. Cis, state of or condition. Tomy, process of cutting or incision. Y is that process or condition. So notice you've got a couple here that mean condition, but they're very different in how they're spelled. A few prefixes. A and an both mean no, not, without. Ought and auto both mean self or own. Dia, complete or through. End or endo, within. Epi is upon or above. Exo, ex or exo, is outside of, out, outward. So notice here you've got a couple that mean the same thing, and you have some meanings that are very similar. For instance, no, not, without, or out, outside of, outward. Hyper and hypo, I mentioned these before. They sometimes get mixed up, and that's a very bad thing when it comes to medicine. Hyper is always above, excessive, more than normal. Hypo is always deficient, below, under, less than normal. So make sure when you're speaking those two or you're writing those two that you're very, very clear. In means into or in. Peri, surrounding or around. Pro, before or forward. Re is back, backward, or again. Retro, behind. Sub, below or under. Trans, across or through. And that is it for chapter 1. So I would really encourage you to go through, make sure you look through your book, look at the different visuals that they have there, work through the different exercises that they have, utilize your book, do flashcards. Make sure you, again, watch the video study guide, the video about book features, and for sure, the video on your syllabus, and take that syllabus quiz so that I know that you and I are on board together with how this class is going to work. I hope you're having a wonderful day. Look forward to talking to you again soon, and I'll be back soon to talk to you about Chapter 2. Bye.